Now for my concluding page. What is driving your symptoms? So now that you have completed all the bladder health information and you feel very empowered on being kind to your bladder and doing all the right things, then it's my job to find out, why are you having these issues? Why are these muscles not responding to the forces upon it? And what kind of tips can I help you along the way to get you to where you can manage these symptoms? I use this same page for someone that is having a hyperactive pelvic floor muscles, if they're having pelvic pain, testicular pain, pain with sex, just constipation. Why are you having these issues? And it's up to me to be the detective with you, so that way you can go about and keep going about your day. So I like to start on the outside of the body because that is easier for you to participate in. The first thing I actually do is, these are all kind of a little out of order than the way that I would assess. But I look directly at those muscles, like, oh, well, you've got a scar at your perineum, and then everything on your left side is jacked and not working. And then also, because you have that scar at your perineum on your left side and all your muscles on the inside of your body are not working, then I also see that you have tightness in your hips on your left side, and that you have decreased ability to do the piriformis stretch on your left side, and also sciatica pain, and that your SI joint is out of whack. Well, then I would just fix those things. And I would, if you consistently present the same way, then I teach you how to fix those things. I had an interesting person that had a car accident, and it seemed like she irritated up in her higher back along the iliohypogastric, ilioinguinal, right under your like bra strap, T12, L1, and that the car seat had hurt her at her hip. And so I was looking all along, way up here. I was running along the nerves that they travel along the front side of her hip, and then she was having random back pain from gardening. And so then I looked lower at her SI joint and found that I moved everything back in place. And then she came back and saw me, and she didn't have any leaking at all. So I like to look high up in the spine, and that is why, because these nerves are all affected down at our pelvic floor. But then sometimes it's just a quick little fix. So that is really nice whenever that happens. Diaphragmatically breathing is huge. Looking at someone's feet, like, oh, I only leak when I pee. And then it turns out that they have a bunion on their right foot. And so they never heel, strike, and toe off correctly. And so then noticing that it messes with their posture, and they run more forward flexed because they can't put their weight on their toe, which allows your lumbar spine to not be so in a lumbar curve. And whatever your lumbar curve is doing is what your tailbone is doing, which is affecting the strength of your pelvic floor. So getting her bunion fixed, or figuring out what was going on with her feet, was huge. And it may be something as simple as that. So I rub people's bellies almost every day, because it's a nice way to get to know somebody. And I find out, like, oh, I was not expecting your tummy to feel like this. I feel tummies all day. And so it's nice to feel what your tummy feels like. So these are just a couple of things that I look at. And this is the stuff that I focus on for those 3 months. I see some people much shorter, like 3 visits. And then I see some people much longer, because they've had their symptoms for longer. And you get what you put into it. And so that is something that I like to reiterate, that once a week for 12 weeks, once a week for a month, isn't going to help your symptoms go away. It's going to be putting the ball in your court. And so I am going to close this page up and just thank you again for taking the time to take care of yourself. And I hope that you have all the tools in your toolbox to feel better. I encourage you to find a pelvic floor physical therapist. There's a lot more out there. Find one that specializes in the kind of care that you want. If you love yoga, then find a physical therapist that specializes in yoga and pelvic floor physical therapy. Go to your yoga instructor. Maybe they know somebody. If you have back pain and you've always had back pain, then find one that's orthopedically specialized. Find one that matches the kind of care that you want to provide, that you need. It's nice that we can be a little bossy with how we spend our money. Like, if you don't want to buy the shirt from that store, then don't buy the shirt from that store. Like, it is your money. Spend it how you want and find someone that's going to treat you the way that you want to be treated. And so I hope that all of that is helpful. I like to pelvicrehab.com. You can type in your zip code and you can find all the pelvic floor physical therapists in your area will all pop up. And you can, usually they'll have like a bio on there. I'm on there. I change my bio all the time because I'm like, I don't know. It's hard to squish everything that I want in a short little bio. And so, but it may help you find someone who's more specific to you. So remember, you are fearfully and wonderfully made. Take care and God bless.